Debbie Stadtler, Editor-in-Chief of Provider Magazine. Today I'm here with Dan Baker, President and CEO of HealthDrive. Welcome.
Hi.
Well, since its founding in 1989, the HealthDrive network has grown to more than 700 medical and dental professionals who serve more than 4,500 long-term care facilities across the nation, performing a total of 1.7 million senior living patient encounters every year. That's quite the reach.
Absolutely.
Well, tell us a little bit more about HealthDrive and how you partner with long-term care facilities to care for the residents.
Yes, absolutely. So HealthDrive is a physician practice management company, and we manage 6 different specialties delivering care into long-term care facilities. Primary care, we provide medical directors, attending physicians, nurse practitioners, as well as ancillary services supporting the primary care services, behavioral health, audiologists, podiatrists, dentists, optometrists. Like you said, pretty significant scope and reach. We'll do 1.7, 1.8 million patient encounters this year. And really the company has been able to scale and grow to that size. As you said, 35 plus years doing exclusively long-term care work, and really holding firm to what the principles of the company are. Focus on our patients, focus on our providers, focus on quality and on compliance. And that's really been our key to success.
Well, you mentioned compliance. How do you feel about the recent legislative changes and uncertainty in the industry? How will that play out? And then how does HealthDrive help their customer base navigate all of that?
Yeah, absolutely. Look, there are significant downward pressures, across the healthcare ecosystem, and long-term care is certainly not exempt from them. Whether it's on our facility partner side and some of the pressures that they're feeling, the physician service reimbursement side is similarly feeling those pressures. And so now is really the time that we have to double down on quality. The winners coming out of this are going to be those that are focused on quality. And HealthDrive really is positioned really well to support our customers, our facility partners. Consistency is a big part of this, right person, right time, helping our partners focus on reducing hospitalizations, length of stay, number of medications that our patients are on. And all of those are really the folks that develop those strong partnerships. They're going to be the winners at the end of the day, particularly as we continue to move towards outcome-based reimbursement, PDPM, value-based care. And so making sure that you have those strong partnerships in place is going to be critical.
Well, you mentioned a big topic, value-based care. How do you see value-based care evolving in the long-term care space over the next few years?
Yeah, so value-based care as a whole is somewhat still in its infancy, and certainly so in the long-term care space. I-SNPs have been around for a little bit. Medicare shared savings programs are starting to penetrate a little bit more, ACO REACH programs. But really, I think for long-term care, where we end up is not where we are today. So I think it's really important for our facility partners, medical groups like ourselves, to position themselves well for what is coming down the road. And so strong partnerships is going to be key. We want to work with good facility partners who have quality staffing, quality deliverables on the nursing side. Equally so, our facility partners need medical staff team members that are focused on driving outcomes, right? Because that's where we're going. Is it has to be, how can we provide training? How can we provide education? And then doing that in a standardized format, right? And that's really, certainly from our side of things, has been a challenge over the years, just from an industry standpoint, is how do you deliver that standardized care? And so HealthDrive has really put ourselves positioned well to be able to help fill all of those gaps for our partners on a go-forward basis and really help them get prepared for what's coming with value-based care.
Yes. Well, there are a lot of moving parts, a lot of options, a lot of changes. It sounds like a very complex environment. How do you help your customers be prepared?
Yeah. So the first is consistency, driving consistency. The use of technology and some real interesting things that are happening in that space. Long-term care, not always known for its technology, but I think that dynamic is shifting. And then data-driven analytics and insights, right? And so if we break down those three, consistency, the core of the HealthDrive business is we have to find good providers and we have to keep them, right? And that is, if there's anything I think I'm proud of, over my tenure here at HealthDrive, that we are headed into our 10th year of an 80+% provider retention rate.
Wow.
I mean, it is just the key to this business. There's a lot of other things that we do, but You got to find good quality clinicians, and you got to be able to keep them. Where I think a lot of the innovation is coming and excitement is in the technology side of things. And so, long-term care in particular has been very heavily focused on documentation for regulatory purposes, and it takes a lot of time away from patient care that clinicians are spending on documentation. And so we've made a significant investment into deploying some interesting machine learning, AI technologies that really significantly reduce the administrative burden on our staff. AI scribes, helping build notes for our folks, pulling forward stuff. And so that's been a real interesting evolution, and we've seen significantly increases in productivity, provider satisfaction levels. Additionally, grasping the data has become super important. And so over the past few years, there's been a big push by vendors to nursing homes like myself and others of, how do we get data from the nursing home EMR, right? In the olden days, it was open a paper chart, transcribe from one paper chart into another. Now that everything's electronic, is how do you go get that? And so there's a lot of folks who are getting the data from PCC or getting the data from Matrix. And we're right there. We're one of the largest vendors in that space. And but we're taking it a step further. And not only are we providing clinicians to the access to that data seamlessly from the nursing home EMR, we're also integrated with all of the state health information exchanges, HIEs. And we recently deployed a new technology that allows us to interface and get data from all of the major acute health systems, the Epics, the Cerners, the Meditechs. And so it's a very powerful tool, particularly in our primary care practice, where instead of just having some discharge orders from the hospitals for a new patient, we can go back and see all of their past treatments, past medical histories, and then we leverage AI to help provide summaries of those sometimes 200-300 page documents that really just cuts the administrative time for our clinicians down significantly and gives us all this data, right? What's happened, what's worked, what hasn't worked, how can I risk stratify these patients and help my nursing home partners, help my clinicians be able to say, here's where I need to spend my time today. And so that's where we've seen a lot of the evolution in the past 12, 24 months is grabbing this data, use of this advanced technology, and really helping deliver a better quality for both our partners on the facility side as well as our patients.
Absolutely. I mean, technology and data is such a hot topic right now, but I love that the focus is really on using it to help drive the quality and the efficiency and all of those. That really makes it powerful.
Yeah.
Well, who else besides long-term care facilities do you partner with?
Yeah, so this has been super interesting for us, in the recent past is we've started to get solicitations, outreaches from a lot of payers and hospital systems who are seeing some of the interesting things that we're doing on the technology side, the results that we're delivering on hospital readmission rates, and they're reaching out saying, what are you doing that's different, and how do we replicate this and get it out there? And so we've developed a lot of partnerships with health systems in certain markets where we partner with them to help educate their high referral networks. It's a benefit to us as we get more opportunity. It's a benefit to the health system because all their metrics that they're measured on, we can deliver very quality results there. We had one group in the Northeast recently. We partnered with them about 18 months ago. We rolled out all of our technologies. We manage data we match our data up against their data. We've seen close to a 40% reduction in hospital readmission rates. We deployed a palliative care program with them that's had a significant impact. And it's a real benefit to our facility partners because the ones that are in their high referral network that are working with us are saving money, getting more referrals, having better occupancy rates. And so it's been a win-win all the way around.
Those are some powerful results that you have seen. Well, how can people interested in HealthDrive get in touch and learn more?
Sure. Yeah. Easiest way is go to our website, www.healthdrive.com. Bottom of the homepage, there's a learn more button, and that goes, right to our team. And certainly, as with all of our customers, anybody's welcome to reach out to me directly. My email is dbaker@healthdrive.com. Pretty simple. And we'd love to hear from anyone.
Awesome. Well, thanks so much for being with us today.
Thanks for the time. It was great.
Thank you.